Doctor's office.
When guidelines change, phones ring, and patients demand answers.
Should I come in? I'm confused. I know in my heart I really should come, but this newspaper is telling me something different.
The catalyst? Medicine based on current research running headlong into conventional wisdom.
I was appalled.
Shocked. Absolutely shocked.
While some are shocked over changes in 2 cancer screening guidelines this week, it should be no surprise. A recent review found that, on average, medical advice changes every 5.5 years because of new evidence. But especially with cancer, many are reluctant to trust guidelines over their own common sense.
We've been taught to think that the earlier and the more often we get screened, the safer we will be. And now somebody's saying that may not be true. And that's just incredibly scary.
What is true is that medicine is constantly changing. In 2002, doctors found hormone replacement therapy for women increases the risk of heart attack and breast cancer. Last year, men learned that vitamin E and selenium did nothing to prevent prostate cancer. And now there are even questions about the benefit of aspirin in preventing heart attacks and strokes.
What people don't really understand are these are population-based guidelines. Not everyone has to follow them. Doctors will be making individual decisions about individual patients.
Again, it's important to remember the new task force guidelines on mammography are not mandates. The decision to screen is still up to the doctor and the patient, Katie.
And John, since we have 2 doctors in the house tonight, I thought we'd continue the conversation. You know, when people look at these new guidelines for mammograms specifically, they think it must be about controlling costs. Is it?
Katie,
partially?
Well, the vice chair of the task force that came up with the new guidelines on mammography told us that cost was absolutely not part of their conversation. But cost should be part of the national conversation about where we should be spending our money about these screening tests. Not do you spend the dollar, but where do you spend it most wisely?
And Jennifer, I know you have some concerns about the fallout from these specific recommendations, actually both of them that came out this week.
Right, because it's important to remember, Katie, for most women, one of the main reasons they would see their gynecologist every year was to have a pap smear and or get a prescription for a mammogram. And I think now there's a concern that they'll come much less often, or even worse, not at all.
So the bottom line is talk to your doctor.
And don't let this be an excuse not to see your doctor in the first place.
All right, good point. Jon LaPook, Jennifer Ashton, doctors, both of you, thank you so much.